Good morning. Good morning, all, and welcome to this day. So today is an auspicious day. Today is Maundy Thursday, where Jesus Christ was having his Last Supper. So this denotes the night of the Last Supper. And tomorrow is Easter. So where Jesus Christ has resurrected himself from the cross. So this is a day of prayer, and with utmost humbleness and gratefulness to you all for coming up again and again for our reading club. Once again, welcome you all with deep love and prayers to you all. Prayers that we all should success. We all should have lot of course, difficult cases, and we should be able to crack them. Yes. So with that deep prayers, let us go into our duty of reading Dr. Prafful Vijayakar's book. Today we are reading the end of Miasm, My Assumption of Miasm. That is the book that we are reading now. And we are into page number 70, where we have been discussing about the various modes of defense, various defense mechanisms we have covered until the inflammation. Yeah. So inflammation is a defense mechanism. And inflammation is very much needed for a complete healing. If there is no inflammation, there is no complete healing. It can go into a non-healing ulcer. It can go into necrosis. So that where there is a necrosis or where there is a destruction, and inflammation has to set in order to have the complete cure. That's what we have dealt with. Until that, we have dealt. So with an example of that non-healing ulcer, where the patient was having a diabetic callus, which was there for more than 6 months to 1 year. And the ulcer was a non-healing ulcer where even the bone was visible. We talked about that in the last class. After giving Oromet a single dose, the syphilitic destruction gone by, and then psychotic pus formation and suppuration and discharge was happening. And again, within two weeks' time, what had set in? Inflammation has set in. Only when inflammation sets in will the ulcer be completely cured and full proper restoration happens. So this was a beautiful example of a restoration. So inflammation had set in there finally, and there is not even a single mark of what had happened at that site. So this is the beauty of homeopathy, which no robotic surgery can do. So now we are going to the next paragraph. Without inflammation, infections would go unchecked. So if there is an infection, there has to be an inflammation. If there is no inflammation, it is a danger. The infection can go right up to it can cause the blood-brain barrier, or it can cause meningitis, or it can cause some destruction anywhere. It can cross all the boundaries. So if there is an inflammation, of course, we can tackle that. So once again, this golden letter, that is golden sentence, without inflammation, infections would go unchecked. Wound would never heal, and injured organs and tissues might remain permanently ulcerated and damaged. How many of you have seen such cases in your day-to-day clinical practice? Varicose ulcers, non-healing ulcers, ulcers around the ankle region with cellulitis and things like that. And it has been an open wound for how many years? For several months, for several years, it's been like that. A diabetic ulcer, foot ulcer, it will never heal. Why? Because there is no inflammation in that area. If a homeopathy is able to bring about an inflammation there, it can get completely cured. Will any other system of medicine be able to produce an inflammation? No, they can only cut off the necrotic part. They will remove the they will scrape off the necrotic bone tissue, and they will clean off that part, and they will give antibiotics. But then will the wound heal? They will have to do grafting or something to make the wound heal. Yeah. But then also, will there be a scar tissue? Will there be an ugly scar tissue? Will there be a bad memory of that area? In homeopathy, there will be no scar. That memory itself is gone. That bad memory itself is completely gone. Yeah. So is this possible in homeopathy? It is very much possible. So, and we have got a lot of medicines for such things, no? Like acid nitricum, CKL core, then all these jagged ulcers, no? The rubric will be, I did not go into the rubrics now, suddenly it comes to my mind. So I thought I will share with the rubrics. That is the ulcers jagged, ulcers serpiginous, ulcers which go necrotic, ulcers or the felons which go necrotic. Yeah. So where the necrotic tissues are coming up, no, like pyrogen, anthracinum, R-salb kind of medicines, very effective, very, very effective they are. So inflammation is most important. Yeah. If a tissue shows a defensive response, it means every cell should show such a defensive response. Tissues are made up of cells. So if a tissue or an organ is showing a defensive response, the same response is showed by that cell also. Every cell wants to survive and is therefore bound to have a somewhat similar response. Okay. Ultimately, it is the tendency to inflammations or recurrent infections which are harmful and should be taken care of rather than the inflammation itself. What do our allopathic counterparts do? They will take care of the inflammation. Again and again and again, they will take care of the inflammation. What is the best example? Budicort inhalation. For how many days? Is it for 1 day, 2 days? No, it is for 1 year. It is for 6 months. What are they doing here? They are not treating the tendency to inflammation. They are treating the inflammation by giving antibiotics. Okay, the patient is better. For 7 days, antibiotics. Again, after 2, 3 days, the child is coming up again with the same disease. Why is it happening? Because they were trying to treat the inflammation, not the tendency to inflammation. Is it possible in allopathy or in any other system to treat the tendency to inflammation? Not possible. In homeopathy, is it possible? Very much possible. We are looking into that. We don't want to give any ABCD medicine to take care of the tonsillitis, the recurrent thing, or the recurrent allergic rhinitis where daily Montelukast tablets are given. No, daily one Sexine tablet if I take for the atopic dermatitis, there is no urticaria. If I don't take it for 1 day, it comes up. Why is it so? Because the tendency is there. The patient is not cured. Only the inflammation is taken care of. So ultimately, it is the tendency to inflammation or recurrent infections which are harmful. The tendency is harmful and that should be taken care of rather than the inflammation itself. So how will we do the inflammation? Sometimes we will give belladonna blindly, etc. No, to take care of the inflammation. And what will happen? It will bombard again. No, then we know, okay, I was not treating the tendency. I was only treating the result of the disease. That is wrong. We observe that, yes, we observe that in a family with many children, one child may be suffering from recurrent bronchitis or recurrent tonsillitis more often than the other children living in the same environment and consuming the same food and drinks. Yes, we have all seen this. In a family, always one child will be falling sick. So it is the same parents, it is the same genetics, and it is the same house, the same environment, the same dust, the same pets or whatever. Everything is same. The same school they are going to. But then one child falls sick again and again, whereas the others are not. So the virus or the bacteria which cause this infection and inflammation spare the other children and frequently attack the tissues of this child. The viruses are there, the bacteria are there. They are not attacking other children now. Why this child? The whole world is full of parasites which thrive on toxins produced in tissues which serve as nutrition for them. Any clue? The world is full of parasites. The world is full of viruses and microbes, but then we are all not falling sick. But some people are falling sick. Why is it so? Because these parasites and all these things need what? Need food to eat, no? What are their food? It is the toxins. So if we are producing toxins, we are attracting the bacteria. If we are not producing the toxins, that bacteria cannot attack us. Thus, a mite which causes scabies will never attack and manifest itself as skin lesions until and unless the skin cells of a person have disturbed equilibrium and harbor sufficient toxins to feed them. The scabies comes on. If my skin is clean, no scabies can come to me. If my scalp is clean, no parasite like lice can infest my head. If my guts are clean, no parasites like worms can infest my guts. If there are toxins inside my guts, or if there are, that means in my intestines, if there are toxins upon my scalp, or if there are toxins upon my skin, then the worms can come in, the parasites like lice can come in, or the scabies can feed upon my toxins produced upon my skin. This is how a disease comes in. So it is needless to say that the microbes like bacteria, viruses, fungi, or toxins are not necessarily the cause for pathological inflammations, but some change prior to it in the tissues, which acts as an invitation to these pathogens and result in easy inflammations. So what is this? Are you all with me? Did you all get this point? So it is not the bacteria or the viruses which have to be treated. The viruses and bacteria are coming to our body only and only if we produce the toxins. So these toxins are also not the diseases. It is some condition before we produced the toxins. What is that ailments from? What is that condition which what which caused the malalignment or which disturbed your equilibrium? What was that condition which disturbed your equilibrium? Until when was you all right? Until when were you all right? I was all right until the 1 week back. So what had happened after that, in that 1 week time? What had happened just before that 1 week time? Something happened, and after that I started producing toxins because of my altered equilibrium. I could not balance myself, and then the toxins started, unwanted toxins was there on my body, and this attracted the bacteria or the viruses, and now I'm down with an infection and with the inflammation. Did you all get the disease process? Are you all with me? Yes. Now, what are all the symptoms of inflammation? The first defense of inflammation is often associated with irritation, sensitivity, redness, swelling, and sometimes anesthesia. So calor, that is heat of the affected part, you all know it. Rubor, that is red angry look. In a case of eczematous dermatitis or infective boils, the disappearance or reduction of anger at the site, that is red angry look of the site, is a sufficient indication that the right simillimum is at work, and one dose has set about the right curative process. Hence, no more repetition is required, and resolution is now only a matter of time. How many of you have seen this in your clinic? Atopic dermatitis or very red erysipelatous, some inflammation, or scarlet red tonsils, you had given medicine, and 24 hours after you are asking the patient to come and show because it is that severe, right? So we want to take the follow-up every now and then, every 24 hours or at least 48 hours. And when you see, the patient will be saying that I'm not better, it is still there and all that. When you examine the throat, the redness has reduced. Yes, then you know, okay, the medicine has acted. It is only a matter of time. Just wait. And what remedy will you give? Will you want to bombard it again with the medicine? No, just from the look of the redness, the intensity of the redness, you know that the disease is reducing and the medicine has acted upon his genetic apparatus, producing a cure. Hence, no more repetition is required and resolution is now only a matter of time. Dolor, what is that? That is the pain. Pain in a part, whether in a boil or in an inflamed joint, is a symptom which is a friend of an individual. Why is it a friend? The pain in an inflamed part protects the inflamed part from further destruction by sending impulses of pain to the brain of the individual to draw his attention to the affected part. So anywhere we get pain, we will give care to that, no? Painlessness, what is that? Is it a syphilitic rubric? Painlessness of the usual painful condition. Painlessness, similarly, fearlessness. All these things are danger to life. Yes? So pain is one of your friends. Pain is, and fever is one of your friends. The redness is one of your friends, which are all showing the bulb that look at me. Come on, here is my disease. Attend to me. The existence of pain causes the individual to restrict the movement of the part and guard the injured part. Removal or suppression of pain without the inflammatory process subsiding will no doubt lead to further damage to the part as the guard itself is made impotent. Where do you get guarding? What is the most famous pathological condition where you get guarding and muscle rigidity?
Peritonitis.
Peritonitis in appendicitis. Yes. Not in renal calculi. The patient is coming with the right iliac fossa pain. So what are all the differential diagnoses for that? It can be a ureteric colic. It can be appendicitis. It can be ophoritis. Or it can be a colon. It can be a gas in the colon or maybe in the cecum. Yeah. And you don't know what it is. You ask the patient to lie down on the table, on the examining table, and you palpate it properly. When you reach the right iliac fossa, immediately the guarding comes. So then you can be 100% sure about your diagnosis. What is that? It is appendicitis. If it is renal colic, there will be no guarding or muscular rigidity. If it is a gas, there will be no guarding. And if it is a peritonitis, what is the symptom, the typical symptom of peritonitis? It will be silent abdomen, no? The entire abdomen from top to bottom will be rigid like a board. It is not only the right iliac fossa area. It will be the 9 areas of the abdomen will be rigid like a board. When you keep your hand, you will know that this is something dangerous. I should not even palpate. Immediately you have to order for the scan. Yes. So rigidity and guarding is a protective phenomenon for the appendix, because we don't want something to happen upon the appendix, upon that area. So for when the doctor is palpating, or even when the patient is bending or doing something, immediately the protection will happen there. This is a defense mechanism given by the body. So if you want to, when the patient is coming, okay, because it is because of the muscle tightening that you are getting the guarding, it is a muscle problem. It is a rigidity is caused by muscle rigidity, no? And then the guarding is caused by, again, by the muscles, no? So I shall give you a muscle relaxant rather than attending to the appendix, inflamed appendix calling from behind. Is it the correct method of treatment or a wrong method of treatment? When you relax the muscle, what will happen? The muscle will go relaxed. Then the inflamed appendix is unprotected. So it can go into bursting, and then it can go into peritonitis. And it will be an acute abdomen, and it will end up with surgery. So, removal or suppression of pain without the inflammatory process subsiding will no doubt lead to further damage of the part, as the guard itself is made impotent. Here, Dr. Vijaykar sir is giving us an example. It is something like keeping a dog to guard your house from robbers. But when he starts barking and disturbing your sleep on seeing the robbers, the progressive degeneration or destruction of the joints, cartilages, and bones in various arthritis is essentially an effect of maluse or indiscriminate use of painkillers, whether they are allopathic, Ayurvedic, or homeopathic. What is this? When the patient comes with the first stage of defense, that is inflammation on the joints, that is arthritis, you give a medicine, or you give a medicine to take care of the tendency of arthritis. If you treat for the tendency, then there will be no arthritis from that time onwards. If you treat the arthritis as such, the disease in the man, instead of treating the man in the disease, the patient will be having temporary well-being. The inflammation is gone by the local applications, or by all these things like belladonna, etc., some specific remedies and all. Inflammation is gone, and again the patient will have to be put on that medicine for years together. And what happens? Will the disease get cured? No, it goes into the next stage, and ultimately there will be destruction of the joint. So this can happen not only in allopathy, this happens in Ayurvedic or in homeopathic treatment also, where we don't understand the disease process as such. We have to treat the man in the disease, not the disease in man. Now, next thing is tumor, that is edema or swelling. Absorption of edema or swelling is somewhat of a simultaneous affair, along with reduction in vascularization and pain. Stiffness and guarding, again, is a protective mechanism. It should go away only after the inflammation and pain have subsided. See, when there is a stiffness or a guarding, when you treat for the underlying appendix, what will happen? The appendix will be happy. The inflammation of the appendix is gone. First of all, the patient is happy, or his sensitivity is taken away now with the medicine. Then there is no need for inflammation to happen upon the appendix. Appendix is happy now. Then what happens? The protecting muscles, they don't have to protect it so much. So the muscles also will go into relaxation mode. We need not give any muscle relaxant there. Just only treat the local cause, that is the appendix. For that, what had happened prior to the inflammation of the appendix is our question. What did happen? When did you get the appendix? It is an acute thing. Yesterday or now, since two hours back. What did happen? Some fight, no? Some severe argument. Because it is an acute condition, so there should have been something very severe. So you ask, and then I had a quarrel on the road. I hit him, or he hit me, etc., etc. Something, that kind of a thing will happen. Okay, you calm down, you cool down, and then you give him an angry remedy. Like Naxovika, what potency? 10 or chamomilla or anything, no? Any anti-inflammatory drug of uh, that sensitivity, which takes care of the sensitivity of the patient. You cannot give simply belladonna. Of course, if it is bell, you have to give bell. In what potency? 10 or in 50 And then you can keep the patient there. No, for observation, you can keep him there on your examining table. Within 10 minutes time, the guarding and the rigidity will be reducing. which means you know that, okay, the appendix is getting resolved. Yeah. Now the last one is functiolesa, that is loss of function. Yes. Now, the dreaded inflammatory diseases mentioned above are all due to the first defense mechanism at work. If most of the dreaded inflammatory diseases mentioned are due to the first defense mechanism at work, then there is a possibility that most of the other diseases which do not fall into this category are also due to self-defense mechanism at work. What does this mean? You know about one cell defense mechanism so far, that is inflammation. And this inflammation is a defense mechanism, and it is produced by the changes in the cell. So what about other defense mechanisms? Are there any other defense mechanisms? If at all there are other defense mechanisms, they also will be due to the changes in the cells. That is what is the meaning of that sentence. So what is the second defense? That is the constructive defense. So here the cells are changing in a different form, not in the inflammatory form. Constructive defense is a morphological, that means a structural changes are happening there. So this happens in prolonged inflammation. So for the first defense mechanism is the inflammation, which is more or less physiological, where the complete resolution is possible and which is of an acute variety. Now, if the inflammation is going on and on and on and on, what happens? Some structural changes happen there. Initially, it was only an allergic rhinitis. Allergic rhinitis for 2 years. What happens? The bend happens, or what happens? The polyp happens, and that swelling happens, and there will be complete nose block. Along with that, there can be sinus affections as well as polyps inside the sinuses. All these are structural changes happening as a result of prolonged inflammation. Are you all with me? Yes? Now here our famous example is there. Let us imagine for the time being a situation where two people are sitting next to each other. One of them, Mr. X, the aggressive one, tries to poke the second, Mr. Y, with a pointed instrument in the arm. Mr. Y, basically a peaceful, non-aggressive person, cannot fight and does not want to fight, and therefore tries to avoid the poke, which is irritating, by bringing about mere change in the body position. The structure remains to move. Okay, come on, don't poke me. Come on, don't poke me. He will only try to adjust. He will try to move. Then what happens? The defense from the poke or the irritation is brought about with the existing physiology and anatomy. This is equivalent to physiological defense. Only that much. Only an irritation. Only an irritation. This is only a physiological defense. So where inflammation can happen. When this type of adjustment with the existing structure is not enough, and the irritation still continues, Mr. Y starts thinking of other alternatives. He has to get rid of this constant irritation. However, however minor the irritation, when it continues for prolonged period, it can be destructive and dangerous to life. It can, in the long run, make Mr. Y feel brittle. He wants to survive, so he intends a novel method to defend himself from this. He places a fat pillow or constructs a wall or a barricade which he thinks will protect him from harmful effects of the poking irritation. Are you all with me? I don't have to explain this again. So he will want to protect himself from that irritation. How? By protecting himself, by producing a barrier there, by keeping a barrier there. Somewhat on the same lines, the cell, which also has a mind governed by the genetic apparatus, tries to defend itself. After the first defense, which results in swelling or inflammation in tissues, has failed to get rid of the pathogens or toxins, it decides to go in for a second line of defense. So this is what is happening, no? When there is a pollen or allergen or something, which we say, no, we don't know that it is not the pollens or the allergens that is causing the allergic rhinitis. It is only some sensitivity. What is allergy? It is a hypersensitivity reaction. So some hypersensitivity is there in his emotional level. That one only we have to address. That means we have to treat the man in the disease. But if we fail to do so, what happens? The irritation is there always. That means the hypersensitivity is there always. And materially, when we say it is the pollen, it is the dust, it is the fur of the animal, whatever, and that is there always. And what happens? The disease progresses, and finally, when a time comes, the body is not able to produce so much, so it will produce a polyp, or it will want to plug it off. It will cause the turbinates, the inferior turbinate swelling, etc. So it will want to produce something structurally in order to protect the body in the next level. No. So there is a shift in the gears of defense. After the limits of reversible physiological changes is crossed, certain changes takes place in the genes, which induce irreversible changes in the morphology or structure of the cells. So here, the body is always constantly trying to protect. Not possible. Protection is not possible. Then the body introduces the next gear change, the next change in the genes. Some alteration happens, some adaptation happens in the next level. So some structural changes have to be produced there. It is no more physiological, it is pathological, and it goes into the section of the irreversible section. At the level of the cell and its parts, accumulations start taking place. The accumulations can occur in the cell wall or in the cytoplasm. The cell wall starts thickening by excess accumulation of lipids, proteins, or glycogen, etc. Thus, a wall of China is developed to protect the cells from irritation. This thickening occurs due to excess production of everything within the cell or system. Just like an atherosclerotic deposit is happening to protect the artery wall. Yes, when there is spasm of the artery, that part of the artery is getting weaker. It is an intimation for the body. Come on, take care of this. Somewhere by the initial inflammation, the body was trying to protect that. Nothing happened, and now the structural changes has to happen. Lot of atherosclerotic plaques, etc., will be the cementum will be deposited there in order to protect that artery. So similarly, our classical example of the polyp or of the inferior turbinate swelling, yes, or the thickening of the skin or the deposition of melanin, all these things, no, like accumulation and deposition, synthesis, all these things happen we know it is the psychotic phase. So why is this excessive melanin happening? Come on, tell me now. All of you, I'm sure all of you would have been facing such kind of cases in your clinics. Face, or in the side of the forehead, or in the side of the cheeks, or upon the nose, or around the mouth, or in this area, you will have lot, or in the back of the neck, that is acanthosis nigricans. But then these are the hyperpigmentation patches called melasma or hyperpigmentation patches happening here. What are these? These are all depositions of melanin. So all this time there was no melanin, nothing, face was looking fair, everything was fine. Suddenly I started putting on all these kinds of black things. What are they? Why is this melanin coming up there? To protect. Melanin, the black thing, is also coming to protect, as if you are putting a face mask. Why are you putting the face mask? To protect yourself from various things. Similarly, you want to mask yourself from something. On the cheeks means what? Embarrassment. On the face means embarrassment. On the nose means embarrassment. And somewhere your dignity is lost, or somewhere maybe your calculations are lost. Maybe life is not according to what you have thought about. So ask about that sensitivity and you give a medicine. It works wonders, dears. It works wonders. So all these psychoses are for the thickening of the skin, the after continuous scratching, atopic dermatitis, the normal eczema, which we cannot cure sometimes. Until we touch the sensitivity, there is no cure, no. So what happens? After a lot of scratching, thickening happens. Thickening is for protection, the next level protection. This thickening occurs due to excess production of everything within the cell or system. The pathology which can arise out of such a defense includes growth or thickening pathologies like polyps. We have talked about that. Warts. Yes, suddenly the warts can come up. Cysts or tumors or atherosclerotic plaques or deposition of pigments and minerals. We talked about all of things. Yes. Okay. Yes. The third defense. Okay, now we have talked about the second defense also. Now we are going into the third defense, that is the destructive defense. Again, that is a morphological thing. Till now, any doubt? Before we go into the syphilitic thing? Any doubt? All fine? So continuing the story of Mr. X and Mr. Y, when Mr. Y finds it difficult to counter the hostile effects of the stimuli by either physiological changes or the constructive changes, he might decide to cut off the arm or the part which is being poked or under attack. Okay, the physiological defense is gone. Then the next gear, that is the constructive defense, that is also gone, not working. Then what will you do? You will have to chod do that place, no? That part you have to sever off. You have to cut off that part. He decides this defense to save the whole body from the effects of that attack on the local parts, no? Just like soldiers, no? In order to protect the civilians, they will go into the war front and either they will kill or they will die. So that my fellow people sleep nicely in the night, no? I have to guard my India, the border security force, no? Salam to them. So he decides all the soldiers will have to have what element in them predominantly? Syphilitic miasm. Can the soric people go and stay there? Not possible. Can the psychotic people go and stay there? They can do some manipulations, no, or they can prove themselves to be as motivators or as higher officials, or they can take care of the office properly. Such people are also needed, no? Not all persons can go and kill. Management should be done, no? A very highly efficient management should be done. That can be done only by psychotic predominant miasm. He decides this defense to save the whole body from the effects of the attack on local parts. What is the best example? Amputation. Amputation. Necrosis spreading upwards. When the necrosis from the foot is spreading upwards from a big toe, so is it better to sever off that big toe, or is it advisable to allow the spread of the gangrene or whatever? So when the first defense of inflammation is not sufficient to take care of the invading hostile stimulus, the cell may undergo changes at the genetic level. Again, the brain of the cell is asking to change at the genetic level. Again, the next level of adaptation happens. All the changes in the genetic level are nothing but the adaptations. It shifts its gear of defense to defend or to save the whole organism by destroying a part of it. Okay, let me sever off this thing. Like, let me cut off the blood circulation to the big toe. I don't want the big toe as of now, like thromboangiitis obliterans and all, no? Okay, that part of the toe, I am not able to produce any inflammation there. I am not able to do any constructive defense there. I have already produced blackness, etc., there, but then still not able to protect that part. Then what will I do? I will rather cut it off. In Malayalam, we will say, no, "Poganja kolli porthu," which means that one little amount of spark can burn the entire house. So in order to do that, whatever small spark is there, take it out of the house. You go. That's it. Let we all stay properly. So in order to save the whole, sometimes this is the last defense mechanism of the body. There is no other way. Now I am defeated. I am not able to do anything further than this. So let me cut off this part because I want to save the whole. I want to live. 90% of the parts, collect them and live your life. This defense can also be restored. This defense can also be restored when the second morphological constructive defense fails. Sorry. I read it in the wrong way. This defense can also be resorted to when the second morphological constructive defense fails. The pathological conditions that arise out of such defense include all destructive pathologies like gangrenes, necrosis, ulcers. Now tell me, how many of you have treated gangrenes, necrosis, non-healing ulcers? Give your experience here. Whether it was a cure or not a cure, we don't mind. Give your experience of seeing an ulcer, seeing a gangrene, taking care of the patient. Yes, how did you manage the case? Whether it was a failure or success is the next question. There are 14 participants here. Anybody? Atira, Lavanya, Arya, Anusha, Nuha, Archana, Monica, Dr. Sufia, Atira, Gokula Kannan, then Kayal Viri, Shubhangi, Saumya. Anybody have seen a non-healing ulcer or a gangrene? Syphilitic, no? Total distress. How many of you think that, yes, Dr. Sufia is saying she has seen? Anything you want to discuss here, Sufia? Anything you want to? Appendicitis, Kyle Viri was saying. Okay. Discuss here. Would you want to? Yes, Noha. Would you want to explain what it was? There is no point simply reading the book, right? Without sharing. We learn from every share. Sophia or Noha? Subhangi is saying varicose ulcer, I'm treating. Bleeding has stopped in the last month. Ulcer is healing now. Excellent. Excellent. So I shall give one more example of mine, which I remember now suddenly. This case, I think I have presented somewhere at Madurai. So this was a case of a felon. Dr. Kailviri is saying non-healing ulcer, but not diabetic. Maggots developed, but treated well with calcarea carb. Excellent. Excellent. So what had happened, Kailviri? The maggots are gone, all by our treatment with calcarea carb. The maggots are gone. Yes. See, venous ulcer under treatment improving. Yes. What do you expect there? What is the kind of in improvement that you're expecting there? Miasm wise, destruction should disappear and construction should come up, and construction should disappear and inflammation should come up. This is the pattern. If you are able to see this much, then you know that the medicine is acting in the right direction and the cure is in the right direction. So initially, we may not be able to judge it in the initial 1 or 2 weeks. Sometimes there will be no reaction. Dr. Sophia is saying it was an ulcer on the foot, which was circular in shape. The person was completely indifferent towards it. Very well. Sepia was given and healing is taking place. Very well, very well. So this is indifference is a syphilitic miasm, right? We should have love for ourselves. We should have love for all the parts of the body. Only then our body will be in the perfect uniformity. So here what happens? When there is indifference, the ulcer will be given, not be given any heat. So there will be the healing will not happen there. There will be no healing there. So where were we? When we are talking about the syphilitic ulcers, in the initial, we have done the case taking very well and we have given calcarea carb, for example. And what should happen there? Maybe in the initial 1 or 2 weeks, we may not be finding any changes for such a long lasting ulcer. But then we can see some minor changes in the degree of syphilitic miasm. Okay, the night pains are reduced. The ulcer is the same. There is no change in the ulcer. The bad smell, the intensity of the smell is changed. I can feel that, doctor. When I'm cleaning it, I can see that the inflammation, the bad smell is, the offensiveness is reduced. No psychosis has started coming up. It is still in the syphilitic phase. But then you have to find out these degrees of intensity of the destruction is coming down. The degree of destruction is lesser now. The offensiveness is reduced. The night pains are reduced. Yes. And the patient is better able to sit. Previously, he was in the lying down position only. Now he is able to go to the bathroom and come back. Previously, he could not even do that. He was on diaper. All these changes, no? All these small changes, you know that, okay, the patient is slowly coming into the psychotic phase. And he is now eating 2, 3 mouths of food. Previously, he was not taking any food. All these are the changes in the general well-being also, no? Slowly, what will happen? Construction will happen. And then there will be a lot of pus. The flies and all will come and sit, and then maggots can be there. That is also in the psychosyphilitic. Of course, when the total syphilis means there will be cut off of blood circulation and cut off of nerve circulation. So there is no scope of the maggots. The maggots want to eat on something. In the total destructive phase, there is nothing to feed on. So there will be no maggots. In the psychotic phase, the flesh will be coming up and then comes the maggots to feed on the bad flesh. And when that thing goes away, you just have to wait. Just like daringly Dr. Kyle Vidi has done that. I have never seen any case of that form. I have never treated with any maggots and all. So here, maybe with we want that case to be heard, Dr. Kyle Vidi, at some point of time. You just follow it up properly, and then we want to discuss on that case in one of the upcoming classes. Okay, Kyle Vidi? Yeah. Because that is a very, very interesting case and it will be an eye-opener. We all will be learning something new from Dr. Kyle Vedi that day through this case. And then after a sufficient period of waiting, all the taking care of the wound should be there. How will you take care of the wound? What are all the medicines which you can give to take care of the wound? Come on, open discussion. Will you give betadine? Will you give tincture iodine? Will you give, what will you give? Will you give just saline water? Will you give potassium permanganate to treat? Or will you give baptisia mother tincture or calendula echinacea mother tincture? Come on, open talk. You want to take care when the maggots are there or when there is an offensive discharge coming out, when it is oozing nicely. What you will say? You don't take care of it. Let the maggots come. You keep it open. You don't clean it. What will you say to the patient in this era, in this century? You cannot say that you have to neglect the wound, right? You have to take care of the wound. How will you take care of the wound? What solution will you suggest? In homeopathy, we have got fantastic mother tinctures. Why would we want to ignore all these mother tinctures for the external application when it is needed? It is not going to cure the ulcer. The ulcer can be cured only by the dynamic medicine, which is given inside in the form of a potency, not by the mother tincture. But then these mother tinctures have got extensive curative property, antibacterial property. So what you can do, you can wipe it off. You can wipe it off by taking calendula mother tincture or echinacea mother tincture or baptisia mother tincture or millifolium mother tincture or any of such mother tinctures. Some 10 to 15 drops of this tincture should be put in one glass of in half a cup of lukewarm water with clean cotton. You can wipe off the surroundings of the wound first, not directly the wound. First, you have to wipe off the surroundings of the wound first and throw away that cotton. Then next take another piece of cotton and then wipe on the ulcer once, throw it away, and then a second time, throw it away, enough. And if it is, then the oozing and everything will be cleaned, the ulcer will be cleaned. And then if you are at home, you can keep it open. Better to keep the wound open. Why? For the oxygenation to be there. If you keep a gauze and if you tie it out with a gauze and all, only when you have to go out, you have to do the tying with the gauze and all that. Once you come home, it is always better to advise to keep the wound open. If too much of oozing is there, once or twice the cleaning can be done. Give them a homeopathic solution and ask them to clean it off and keep the wound open and to take the internal medicine diligently. And what will be the internal medicine? All SL only. Once you have given the life-saving stimulimum, that is the GCS has been given, that is the medicine, and you are observing and you are calculating what is happening to the patient, and you know that the patient is slowly improving. How do you know? The syphilitic intensity is coming down. And then you know that anyway the psychotic thing will come up. Of course, now the patient is in the psychotic phase because the flesh and blood is there and the pain sensitivity is there. Calendula echinacea. What is the other? The other thing which I use is millifolium. When there is lot of vein involved, if it is a venous ulcer, I generally use millifolium. Believe me, I have not given any mother tincture to that Auromet case and all because that case was far away from my place. I did not give him any mother tincture. I have given only the single dose. But why I am giving you this education is, you cannot tell the patient to neglect the wound. Yes, you want to have proper care of the wound of that place. Proper care does not mean that with that care only the cure has to happen. That is not possible. Yes, Kailvedi, it is the hygiene. You understood me nicely, correctly. It is, I'm talking about the hygiene here. So for that hygiene, either you can advise just saline water, plain water, or if you want to add a little bit of psychosis to that, like if the patient is asking for a medicine to clean, these are all the options that you can follow, like baptisia mother tincture or millifolium mother tincture or such calendula echinacea. Syzygium mother tincture, I don't know, dear. I never use syzygium for a cleaning purpose. Maybe that also because any mother tincture for that matter can be used because for external diabetic ulcer, maybe yes, that is a better choice there. But then do you think that the syzygium Q will help you in the cure? Never. It is not going to cure. And will the syzygium mother tincture sometimes given internally or syzygium 1X or triturations, will that help to cure the diabetes? Never. Then what will help to cure the diabetes? Only when you treat the man in the disease, will the diabetes get cured? Until you have not touched the man, the disease is not going to get cured. Bacteria in which type of ulcer? In where you think that lot of bacterial infection is there. When the ulcer is super added by bacterial infections, you can always try out with bacteria mother tincture to clean the wound. Okay. Any other questions are there? We have finished with this chapter. I don't want to rush off to the next chapter. I want this class to go lively. Be practical with our day-to-day sessions in day-to-day activities in the clinic, more practical rather than theory. Any doubts, any common doubts?
How to handle profuse bleeding, like endometriosis, even though hormonal imbalance also the profuse and prolonged bleeding. So it is very difficult to handle.
Correct. Endometriosis is very common nowadays. Endometriosis encroaching into the myometrium, that is adenomyosis, with lot of pains and with lot of bleeding. This profuse bleeding, that is difficult only. But then we will have to stick on to our principles. Maybe it can come as an acute exacerbation, then you can try out with some acute remedies there. You are already giving them a chronic, that is the GCS, like acid force or acetic acidum or lacasis or calcarea carb or natrimur or sepia, whatever is the constitutional medicine, you have been giving that medicine, and the patient, the next time when the patient is coming, the patient is saying that there is lot of bleeding. There is lot of bleeding. So you can give them a phenotype there. You can give them a state remedy there, which means you can give them an acute remedy there. So by looking into the type of the bleeding, is it a black, dark bleeding, or is it full of clotted, or is it what to say, more the flow, more the pain, etc. No, like actia racemosa. How many actia racemosa and all? How you have to give 200 or 1 m, few doses, maybe 2 or 3 doses will do. With that, the pain and the bleeding and all such things should be arrested. I remember one case of crocus sativus where Vijaykar sir has given this crocus to a patient. He was somewhere in the foreign country and he was having lot of bleeding from the nose or something. And this patient was a singer and a joke maker always. And he was a dancer also. So singing, dancing, and bleeding. Vijaykar sir had given crocus sativus 1 m single dose, and then the bleeding immediately stopped. Whereas he was bleeding from the ICU, and the doctors were all shocked by giving that one potency. This bleeding immediately stopped, whereas they were not able to control the bleeding in the ICU. So this is how the bleeding has to be stopped. So, in my opinion, I have tried a lot of cases with high potency medicines, single dose or water doses. In the initial 1 hour itself, I could stop them. One was Lacasis 10 m or Crotalus horridus 10 m, single dose. I have never tried Crocus sativus 1 m at all. I have tried Ipecac 50 m. Ipecac 50 m, single dose. In water dose, maybe every 5 minutes, I will ask them to sip one sip of water for the initial 1 hour. In that time, water dose method. Dissolve one dose, a normal one dose of Ipecac 50 m or Crotalus horridus 10 m in a cup of water. I will ask them to take a small water bottle, 100 ml. 100 ml water bottle, which we generally get from all the marriage parties, a very small water bottle. So it will be having only 2 to 3 gulps of water in that. Dissolve it, give it nice shake, and have one small gulp of it every 5 minutes. If the bleeding is pouring, if the bleeding is full of clots and full of pouring, it has to be stopped immediately. And I will ask them to sit, take rest, and to have energy drinks. Then what happens after 1 hour? They will tell me that excessive flow is stopped. And now the patient is up and be able to walk. After that, you can give the GCS, whatever GCS you have already given. Yes, like pulsatilla or sepia or whatever, no? That one you can continue. Or whatever SL you have given, no? Like some pills or tablets you would have already prescribed, ask them to continue that. Some BT, biochemic tablet or some pills, ask them to continue that. And you have to monitor the patient and help the patient out. Like if there is any zoning or if there is any giddiness, you have to check the BP, you have to check the pulse rate, and you have to feel the patient, no, the hands and all. You have to feel the patient if the patient is there with you, or you have to ask one of the bystanders to touch and feel. Nowadays, everybody have got this pulse oximeter at home thanks to the COVID, or everyone have the BP apparatus at home. Ask somebody to read the BP if the patient is feeling giddy, and you can guide them over the phone. Okay, do one drips, na, put one IV line and come back home. Isn't it? Such kind of management stuff you have to do because you are responsible for all those things. The patient don't know. The patient can even fall. Then it will be a bad mark for homeopathy as such. Because you are a doctor there, you are the physician there. You cannot say that I will do only homeopathy. Whatever is feasible for that situation, you have to do. You have to check the BP, you have to check the pulse, or you have to educate the husband or somebody to take care of her properly, give her oral solutions. And if it is too very bad, don't hesitate to send them to a hospital or get the advice of a staff nurse or someone and do an IV to protect the patient. Yes, all those things has to be done. So the learning, the tips is when you are having a very severe bleeding, give the indicated remedy in the 10 potency. Sometimes there will be a clean tongue and no thirst. This is my indication for ipecac. And ipecac will be slightly haughty, like platina. Sometimes we say that ipecac is the chili platina. And we say China is a chili platina. China, that reverse frown will be there. That irritation or that anger, the suppressed, all this irritation, tormented by everything around him, that kind of a feeling, that kind of a face expression will be there for China. Then China you can give, and with lot of weakness and all, no, the patient will not be able to rise from the bed. When he rises, automatically the giddiness starts. All these typical symptoms, you will be able to get it through video call itself. The patient will be lying down and talking, which is the medicine, China. If the patient is sitting up and talking, which is the medicine, it can be ipecac, or if it is talking clearly, haughtily, and sometimes nausea will be there. You see the tongue and give ipecac if it is bright red blood with not much clots, but bright red blood will be there. Whereas in crocus, big clots will be there. When the patient is saying that big clots with one clot, one full pad, double XL pad is fully over and it leaks out. What is the remedy? Crocus, because it is hysterical, no? With it, because it is a hysterical kind of unexpected flow. Suddenly it comes as a cloud burst, a big clot. What is that? That is crocus. Give that. In the 1 potency or 10, not in 230 potency, it will not help you. When the situation demands, it should be similar similibus in every domain. Not only in the medicinal part. Okay, I have selected the medicine and nothing, no reaction had happened. Was it similar similibus to the intensity of the case also is very important. So you have to give it in the highest potency, what is available in your pharmacy. Sometimes 50 or sometimes 10 Even sometimes for that matter, if you don't have anything in your armor left, you can give the bleeding remedy like millifolium 10 millifolium 10 single dose. That can help you out in that. That is, this is what is known as the state remedy. Be practical, state remedy. You look into the repertoire. You confidently ask the patient, what are the symptoms? How is the bleeding? Is it pouring? Yes, it is pouring. Is it black in color or bright? No, it is black in color. Is it clotted? Yes, it is clotted. Or no, it is not clotted. It is only pouring. And so look, take into those modalities. Is it more in the night? Yes, it is more in the night. Or it is equal in the morning and daytime, everywhere. Every time it is, if it is equal. And what are the concomitant symptoms? Like, is there any giddiness? Or is there any nausea? All such concomitant symptoms. Or is there any diarrhea? Or is there any what is that? Urging for stool. Inefficient urging, insufficient urging for stool, that thing, no? Or of the next formica. And looking into the disposition. You can always come to one remedy and give that remedy in what potency? 10 potency. Thus, you will be able to tackle that situation. Then the patient will be happy. Okay, that bleeding is stopped. I'm happy with that. Now you get some time. Yes, now you get some time to go into the look into the case again, because sometimes it is not easy. Okay, dears. Anything else? 3 more minutes left. Are you all enjoying the session? Dr. Sufia is saying, recently gave Calcareaca 1M to a lady who said flow increases on slightest movement and bleeding reduced by next day. Wow, wow, wow. Very good. All this gives us strength, no? Yes. If everything is okay, shall we wind up for today? Next class, I think there will be, next Thursday, there will be no class. I'm busy with something. Okay. Bye, dears. Let us see again and again. Thank you, dears. Deep gratitude to all of you.
Thank you, ma'am. Thank you, ma'am.
Thank you.